prepared to speak to the issue at all.
I thank my colleague for yielding, and as we are moving forward now, as it looks like we're going to move forward on this debate and vote on the Pelosi health care bill, where we're going to have a massive government takeover. I'd just like to have a dialogue with my friend to talk about some of the issues that the American people need to consider. And I think I heard before I came over, I heard my colleague talking about some of this, and I know what a fan you are of this document right here.
Yes,
it's called the Constitution. And as you go through the Constitution and you go through the 10 amendments, the first 10 amendments, the Bill of Rights, and people wonder, now if you can build a nation off of 37 pages, why does it take more than 2,000 pages to build a health care system? It's very simple. You go through and you take a look at the first 10 amendments to the Constitution. The first 10 amendments to the Constitution are all about enshrining freedoms. Congress shall make no law respecting an establishment of religion. The right to bear arms shall not be infringed. The right of the people to be secure in their persons, houses, and papers and effects shall not be violated. And it's all about the government shall not. The government shall not. And again, it enshrines your freedoms in my freedoms. The health care bill, 2,000 pages. And what's in that bill? What's the difference between that document and this document?
Well, just reclaiming my time here, Congressman Hoekstra, the main difference is that document that you hold in your hand primarily chains down government. It dictates to government, not to the individual. It empowers the individual. When George Washington and some of the other founding fathers put this country together, they did something that was singular in history. They were in a position to arrogate all kinds of power unto themselves. They had just thrown off the crown. They had done some amazing things, and the people of this nation loved them. And they could have had any kind of power, any kind of government mechanism really that they had tried to put together. But they did something very amazing, and it has changed the world. They said, for once we're going to empower the individual, we're going to give them the rights, and we're going to tell government what it can't do rather than telling the people what they can't do.
The gentleman will yield. I was having this discussion with a friend of mine, and he says, you've got to get away from that term empower. But actually that's exact, because, today empowering, the very foundation of American society and American government, we made that decision, more than 200 years ago, that in America we would empower the individual, and the Constitution enshrined that, and it's worked phenomenally well. And what this bill that I don't have with me, but this bill of 2000, I don't take it with me because you don't carry it very many places. It's 20 pounds. Tomorrow we're going to, we're going to unroll this bill. We rolled it up as a scroll, and it's more than 1/3 of a mile long, meaning that I could leave my district in West Michigan and go to Chicago, and I could stand on top of the Sears Tower, and then I could put the Washington Monument on top of it, and I could drop it, and it would be from the top of the Washington Monument on top of the Sears Tower and would just about get to the ground. That's how long this bill is. It's more than 1/3 of the mile if you lay the pages on from end to end, and this is just 37 simple pages. And what this bill does, like you said, the Constitution, that's a great way of putting it. The Constitution chained government and put limits on government. This health care bill chains you and me and each and every one of our constituents, because in this bill, I've not counted them all, but I think someone who has says, but I think it has in it over, 3,000 times?
If the gentleman would yield, I can give you the exact number. the word shall appears in this bill 3,425 times.
So whereas this bill or this Constitution has in it the word shall not, I would bet that the term shall not does not appear in this. Those two words do not appear together very often in this health care document, but over 3,400 times it says shall, and it's like, you know, the Health and Human Services shall. But most importantly, it is the commissioner shall, meaning he or she. What we've done is we've taken the rights from this and we've taken them away and put them into this health care bill and say the commissioner now shall make these decisions, shall make the decision as to what kind of insurance policies are available to you and to me and to our constituents and which ones are not, shall determine what benefits are going to be in a basic plan and shall be available in a premium and a premium plus plan. That the commissioner shall decide whether you and I can get health savings accounts. Actually, we've already made that decision. That's a decision that we in this House shall decide, because health savings accounts will no longer be available. And so it is a great transfer of power from where the founders wanted it to be to where now this House believes it should be, because this House now believes, or may believe, this bill, because as you were outlining before I came here, you know, you outlined some very, and they're not simple, they're complicated issues, tort reform, competition, availability, and those types of things. But those are the types of things that we could do that would address the specific problems that we have in the health insurance market and that we have in the health care area today, that would specifically fix those areas and make insurance more affordable and more available for the people who don't have it today, whereas this new massive bill says it's going to change for all of you. The commissioner shall decide. And for those of you that have a health care plan, you can keep it for 5 years, maybe. But after 5 years, you can be pretty well assured we all shall have a new plan that shall be determined by the commissioner, and we shall not be able to buy anything else. And you and I have a tremendous amount of background in dealing with legislation that has a lot of shall in it. And, you know, we can go back, you and I weren't here, but we can go back to a very novel and noble idea, the Highway Transportation Bill back in 1956 under the administration of President Eisenhower. And the goal was very, very good. Build an interstate highway system, something that, you know, was very, very much needed, and we built it. And that thing still exists, but now what has it become? It's become this massive bill, this massive process where we take all of this money from the states. So a state like Michigan, I don't know if you're a donor or a donee state.
Arizona's a donor state.
All right, let's explain to our colleagues here in the aisle and our visitors in the gallery exactly what a donor state means. It means that, you know, Michigan, the state of Michigan, we send, 19 cents, on every gallon of gas there's like a 19-cent tax. And for the 53 years that this program has been in existence, for every dollar that we've sent to Washington, Michigan has gotten back 83 cents. And people wonder why roads in Michigan aren't in great shape. I had a constituent a couple of weeks ago come to me and say, you know, Congressman, why can't our roads be like West Virginia? And it's kind of like, we checked, for the average of 53 years, West Virginia has gotten $1.74 back for every dollar that they put in. That's a pretty good deal. No wonder their roads are better than our roads in Michigan, because they get $1.74 back. Michigan gets 83. I don't know what happens in Arizona.
It's in the low 90s, Mr.
Today.
Hoekstra, and it seems like what happens anytime you send something into the federal government for them to send back or disperse, they always whack a little piece of it off as it goes by, don't they?
They whack a little piece off. It goes into this bureaucracy. Then they allocated according to people who may be more powerful than others. That's why your state and my state, why we're donor states. And then they start, at one point in time it was to build a highway, interstate highway system. Today, that money is used for all kinds of things. That money now comes back to Michigan. We've got to put up matching funds. And, 2 years ago, the money came back and had to go to highway enhancement. And you kind of look at it and say, what's highway enhancement? Well, our governor figured out, working with the Department of Transportation, that you shall use this money for highway enhancement meant rather than improving our interstate highway system by, expanding capacity, perhaps putting on a new interchange, or perhaps extending it into an area where we needed it extended, the shall meant you shall build a turtle fence. And what's a turtle fence? It's exactly what, well, you probably not, Arizona, you probably don't have many turtles.
We don't have many turtles.
You don't have many turtles. Well, in Michigan, we got quite a few. But so it was $400,000 for you shall build a turtle fence, and you shall not, use it for an interchange. You shall not use it to fill potholes. You shall build a turtle fence. And I really didn't know what a turtle fence was. I had an idea, but I asked. And a turtle fence is exactly what it's intended to do, or intended what you would think when you'd hear the term. A turtle fence is intended to keep turtles from crossing the highway.
We need a rattlesnake fence in Arizona.
Well, I don't know in Michigan, and I don't know if a snake can go over a fence or not. But in Michigan, they decided to make sure that this fence would be turtle-proof, to make sure that no turtle would go over the fence. They built it about 3 feet high, and then they put one of these round things over the top of it, 3 or 4 inch diameter, to make sure that for those turtles that were climbing turtles, they couldn't climb over to the fence. The irony of this whole thing is I still drive that road, and I drive it quite often. And I still see turtles that have been hit by cars. And you say, now, how can that be? We've spent all of this money. We spent $400,000 to build this turtle fence and to study it. Why are there still turtles being hit on that highway? And then you think about it, and you said, well, I know, you think about it, and it's like, I know why. Because this protects the turtles that are outside of the fence, because they can't get to the highway. But it's really a bad deal for the turtles that were fenced in. They have nowhere to go. They can't get out. And so most of their living area now is the median and a little bit of land on each side of the highway before you get to the fence. But for the turtles that are in the fenced-in area, they can't get to the river anymore because that's fenced in, and they can't get out anywhere else. The only place they can go is stay in the median, or if they want to move at all, they get on the road. So it really didn't work that well. So the federal government, in its infinite wisdom, saying, you shall spend it on a turtle fence. And people say, well, Pete, why bring this up in the context of health care? Why are you and Trent talking about this? We'll see the same kind of decisions in health care. The money will come here, and it will not be fairly distributed to the states. Just like you're a donor state and we are a donor state, and there are other states that are getting an unfair share, the same thing is going to happen to health care. And one of these days, a congressman from Michigan is going to come back home, and someone's going to say, I was traveling through West Virginia. We got sick, and why are their hospitals, and why do they have such better medical care, and their facilities are so much better than Michigan? And the answer will be, well, over the last 30 years of this Pelosi health care, West Virginia got $1.74 back for every dollar that they sent in taxes. And Michigan and Arizona, they got 83 cents. There'll be an inequity in health care. And then the other thing it will be is we'll start spending it on foolish things, because people here in Washington will all have their pet projects, whether it's rattlesnakes or whether it's turtles. They will start siphoning the money off and growing it to something it was never intended to be.
You know, it just seems, I've heard a lot of strange stories about bureaucratic programs, but one that drives peace-loving turtles to suicide is just about too much, isn't it?
Well, it is. And you and I have another program that you and I believe, fought together. No Child Left Behind. Congress, in its infinite wisdom in 2001, again with the noblest of goals, just like building an interstate highway system, just like making sure we left no child left behind, just like making sure we want everybody to have quality health care. What did we do in 2001? You and I voted against it, I believe.
Yes, we did.
We said taking power from parents, and you and I are working on this constitutional amendment together that enshrines in the Constitution that parents have the right to raise and educate their kids, all right, protecting parental rights. And again, it says Congress shall not, government shall not infringe on the right of parents to raise and educate their kids. We're enshrining rights. No Child Left Behind did what? It took rights away from parents and gave them to government. We can't, Washington now forces states and local school districts to tell us what? Go through this paperwork and determine, this process. Well, we'll determine whether your kid's making progress or not. We'll tell you who's a good teacher and who's a bad teacher, what school's a bad school, what school's a good school. You know what? I don't need to send money to Washington and have them come put a bunch of paperwork and try to tell me that.
Down our throats. I'm convinced that all of a sudden those decisions that were better made by the patients will be made by some bureaucrat.
And you and I in 2001, we didn't call it the Pelosi nightmare. We called it, in not so many words, maybe we were a little kinder, but we both genuinely felt it was the President Bush nightmare for education. And what have we found out? There were 41 of us that I believe stood up for the Constitution, stood up for parents, stood up for local public schools, stood up for the states, and voted no on No Child Left Behind. 8 years later, there are a lot of people who now recognize that program doesn't work. It's leaving more kids behind. It's wasting money. And the answer some people have now is we got to spend more. And it's kind of like, no, when you're sending $1 to Washington and the thing that you cut, that you highlighted, Washington skims off the top or bureaucracy skims off the top, we now know that under K through 12 education, when we send $1 from Michigan, whether it's from Holland or Lansing or Detroit, or Pontiac, and it comes to Washington, before it ever gets back into a classroom where we're actually doing what education dollars should do, which is educating children, we figure that we lose about 35 cents of that dollar in wasted bureaucracy. We just had, and I've tried to talk to the superintendent, but he and I have not been able to connect yet, but the superintendent of Pontiac Public Schools, I give them credit. They took the federal government to court and said, this is unconstitutional. It is unfair and inappropriate for the federal government to have these kinds of mandates on our schools, because what's the other thing that they do? When they say in No Child Left Behind, they say, you shall. They don't give them the money to do it. So he said, or the school district said, you can't put all of these unfunded mandates on us, because what you're forcing us to do is to spend money on programs that we don't think are a priority for our kids. We know our kids. We know their names. We know what their challenges are. And we've got these set of priorities that we think we need to spend on our kids to make sure that they get because who wants more, that superintendent and those teachers and those parents in that community, you're right. They know those kids' names. They know what those kids need. And they want to spend the dollars to get the most advancement for those kids. The bureaucrats here in Washington, what do they know? They know the book of rules and regulations and say, sorry, it says right here, Congress said you shall do these things. All I can do is make sure that that's what they do. And that's, again, exactly what's going to go and happen in health care.
And, I would suggest that one of the more frustrating things about all of this, like in education, what happens when government controls it is the wealthy can still pretty much do what they want. Wealthy families in this country can choose private schools for their children because they have the extra money to do it. The poorest of families do not. They're stuck in a system that government controls and runs and almost always makes it substandard because of that reason. And the same thing will happen in health care. The wealthy will figure out some way to get around this. You know, we've offered amendments, as you know, Congressman, in this body to say that for those people who either voted for it or at least Congress, if they're going to pass this thing, should have to live under it themselves. Those amendments get voted down overwhelmingly because there's not too many members of this body that want to live under a government-run health care system. But they're willing to put it on those people who have no choice. And there's something fundamentally wrong about all of that.
Yeah, and you know, what we've seen in the highway system, where it is the money comes to Washington, it gets distributed unfairly, and it comes back to states with mandates on it as to where they will spend it. It also, it's hard to believe, you send the money to Washington, and to get it back, you have to have matching funds. So now they're also starting to impose taxes on the citizens of each of our states so that we can actually get our own money back. So the infringement and the intrusion of the federal government on the highway system. Same thing on education. Michigan's now going through a process, and you know they're considering some spending bills. And part of the spending bill is, well, you know, if we do this, we can get more federal education money back, or we can get more Medicaid money back. And it's kind of like, why do we have to put up our own money to get our money back in the first place? And think if we left it in the states. I think this is where you know, as Republicans lay out our vision for the future, I think, you know, one of the parts that we're going to see on health care, on transportation, it's going to be devolution. Leave the money in the states, send a penny out of every dollar to Washington to let them maintain and, if necessary, expand the interstate highway system, but leave, you know, 98, 99% of the money in the states. We ought to do the same thing with education. Devolve education responsibility to the states. I don't need to send $1 here anymore and only get 65 cents back in the classroom. Do the same thing with Medicaid. Do the same thing with health care. Don't take health care down the same failed road of moving all of this power away from individuals, away from communities, away from states, to bureaucrats in Washington who will distribute it unfairly. The powerful will take more to their states. They will give less to the other states. The powerful will then establish the mandates so that we will run health care the way they believe it should be run, not the way that, you know, markets or individuals who want to direct their health care want it to be run. And they'll skim, and it'll be inefficient. And the bottom line, it won't work. You and I know, and we've seen the numbers. No child left behind is not working. We're leaving more kids behind.
Yeah. Well, you know, it's always amazing to me that if we just have to be a cursory student of history, that we can look back and see that the highway of history is littered with the wreckages of socialist governments that thought that they could manage productivity and that they could create a better distribution system than the private market.
Yeah.
And I don't want to join that litany, and I know you don't either. You know,
No.
you keep making the parallel in education. I'm going to yield to this gentleman here. And you keep making the parallel education. I think it's kind of interesting that in Canada, they started this government-run system, and they ran into so many problems that their people are now suing to get their freedom back. And it's very difficult to get it back. And, you know, it's the same thing with education.
They also can opt out. They do two things in Canada. They cross the border and come across into Michigan to take advantage of our quality hospitals and our quality health care. And for those that have a little bit more money, they fly down to Arizona, especially in the winter, and take advantage of your quality health care. They've got a escape valve.
Well, if they have a cold, they call a doctor up there.
Right.
But if they have cancer or something serious, they call a travel agent.
If they've got the financial resources to be able to do it. You know, I think we also put this in a context of already what's happened this year. You know, very early in this year, we spent $800 billion to stimulate the economy. It hasn't worked. Today we saw the numbers. They came out 10.2% unemployment. If you include those who have stopped looking for work or those who are maybe working part-time because they can't find a full-time job, that number goes up to 17.5%. 17.5% of the American people are either unemployed, stopped looking for work, or underemployed. And, you know, that's the effect of our stimulus bill that was passed. I don't think any of us voted for it. Then you put on top of that the cap and trade vote that my colleague was talking about, which is going to just hammer manufacturing and put a huge tax on every American again and every business on this new carbon tax. And then you put the health care bill on top of it, $1.2 trillion. And people are wondering, why isn't the economy coming back? And it's because we put so much uncertainty into the business climate. We've loaded up the debt. I mean, we've gone, people were talking about, the debt under President Bush. In 1 year, they've tripled the deficit from 450, and that was the deficit under the Democratic Congress. I think the last time Republicans had control, the deficit was around $250 billion. It was going the other way. It was going down. Ever since the Democrats have been in charge of Congress, it has been going up, so that we are now at $1.4 trillion in a single year deficit. All of these new taxes and new spending out there, the deficit is projected to be, $1 trillion every year for as far as the eye can see? And people are wondering why there's not job creation? It's not hard to figure out.